Hello and welcome back. Today we are not going to talk about Parkinson or any type of movement disorder. We are going to talk about headache, which is the most common chief complaint in the outpatient neurological clinic. In fact, nearly every study and my own experience confirm that headache disorders consistently rank number one or number two. And you will see plenty of studies here in the screen. And this is why today we are going to talk about medication overuse headaches, also known by some as a rebound headaches. My name is Dr. Zayas. I'm a board certified neurologist and internist located in East Tennessee. Let's start with definitions. What is medication overuse headaches and how does your provider make the diagnosis? And this is based on the International Classification of Headache Disorder. You need to have the following criteria. Number one, you need to have at least 15 days of headaches per month in a patient with persisting headache disorder. For example, someone already diagnosed with migraine headaches or chronic tension headaches, and then develop a medication overuse headaches has a secondary headache disorder. Also, you must be taking acute headaches medications, the ones that you use to stop or to try to avoid the headaches at least 10 to 15 days per month, depending on the type of medication that we are talking about. And it has to be, so you have to take this medication for at least 3 months in order to have the criteria. I will give you examples later about all these medications in this video. How does medication overuse headaches happen? At first, taking acute symptomatic medication seems to help, but when you take those medication too frequently, your brain adapts, and eventually your brain expects the medication to be there all the time. When the medication wears off, the brain triggers a new headache, like a withdrawal response. You take more medication and the cycle repeats. This is why we sometimes call it rebound headaches. Let's talk now about what medication commonly cause medication overuse headaches. And these are the most common ones. So number one is the triptans, which are a specific medication for migraine. I'm talking about medications such as sumatriptan. Another name for sumatriptan is Imitrex or rizatriptan. Another name is Masalt, and there are many others. All the triptans. You need to take at least 15 days per month of this type of medication to meet the criteria for triptans overuse headaches. The other type of medications are just simple pain relievers, such as ibuprofen, Motrin, or naproxen, Aleve, or even Tylenol, acetaminophen. You need, again, 15 days per month taking this medication to have the criteria for more than 3 months. Also, you can have combination of medication like Excedrin migraine, which contain acetaminophen, aspirin, and caffeine, and you need again 15 days per month. These two, which are I'm talking about opioids or butambital Fioricet, are the worst of the worst. So actually, I never prescribe opioids or Fioricet for patients with headaches because these two classes of medication are associated significantly with medication overuse headaches. So for opioids, clear examples are like Percocet, Norco, Tylenol number 3, Lortab, Vicodin, Tramadol. And with this type of medication, you need only 10 days per month of taking any of these medication or a combination of them to have the criteria for opioid overuse headaches. But the worst of the worst is Fioricet, butambital. So Fioricet contains butambital. Is very, very, very highly associated with medication overuse headaches. And some experts indicate that taking this medication should be in a different level, since even taking less than 10 days of Fioricet can cause medication overuse headaches. In fact, many European countries, including Germany, France, and United Kingdom, have banned butambital altogether for outpatient headache treatment. And that's why I don't use Fioricet at all in the outpatient setting. Okay, in the inpatient, that's a different topic. And remember, unfortunately, you cannot stop cold turkey any of these type of medication. I'm talking about opioids or butambital containing medications such as Fioricet. You cannot stop these two type of medication, opioids or Fioricet, because you might have severe withdrawal symptoms, not just worsening of headaches, severe withdrawal symptoms. So don't stop these two medication. You need to follow your provider recommendations if you are going to taper down these type of medications. Why does it matter? Well, because if you don't recognize this problem and address this problem, it is unlikely that your headache will get better. It doesn't matter how much Botox do you inject, how much new medication do you take, your headaches are not going to get significantly better if you don't address this common problem. The first step is to be aware that these type of headaches exist. If you like this video, don't forget to subscribe to my channel. See you soon.